This campaign is for BioSculpture Technology to prototype and test an endoscopic visceral liposuction device allowing the direct removal of hazardous belly fat within your abdomen. The company is a commercial stage medical device company and design specifier steeped in the science of adipose tissue. It's based on the founder's early recognition that while some fat can just be unsightly, other fat can either kill you or save your life. The company's mission is to develop and manufacture medical devices and procedures for optimizing fat distribution and metabolism, and for fat aspiration and processing based on medical discoveries and state-of-the-art advances. The burgeoning obesity epidemic and its rapidly growing morbidity costs are bankrupting the healthcare systems. 2/3 of affluent populations are overweight, and 1/3 is frankly obese. Obesity-related chronic diseases account for 75% of healthcare spending. 43% of the developed world is forecast to be obese in 10 years. 80% of type 2 diabetics are obese, and 1 out of 5 healthcare dollars is spent on diabetes. Diabetes is the most frequent cause of kidney failure requiring dialysis. Obesity is at least socially contagious. Metabolic syndrome is a disease of 3 of any of these 5 risk factors. 1 is abdominal obesity, which in the Caucasian male is a waistline above 40 inches, and in the Caucasian female a waistline above 35 inches. Triglycerides above 150 milliliters per deciliter. Healthy lipids below 40 milligram per deciliter in men, or below 50 milligrams per deciliter in women. A blood pressure equal or above 130 systolic, or equal or above 85 milligrams of mercury diastolic, and a blood sugar equal or above 110 milligrams per deciliter. If you have 3 of these 5 risk factors, you have metabolic syndrome, and it's associated with insulin resistance, type 2 diabetes, and an increased risk of coronary heart disease. It's also associated with autoimmune diseases and cancers. In short, it shortens your life, reduces the quality of your life, and kills you. Conventional solutions treating obesity involve 3 main techniques: the adjustable gastric band, the roux on a grec gastric band, and the vertical sleeve gastrectomy. The bypass shortens transit time, lets the nutrients go through your bowel faster so less is absorbed. The other 2 techniques reduce the quantity of food you ingest. You take less in because you literally have a smaller pouch to put it into. Laparoscopic approaches have decreased the costs and decreased the hospital stays and reduced the complications of these procedures, but they have certainly not eliminated them. These rates go between 2.4% down to 0.1% overall across the nation. Bariatric surgery techniques have problems. All of them can result in leaks, reoperation, death, pulmonary emboli, diarrhea, kidney stones, fatty liver, erosion through the skin or into the bowel, esophageal dilation, and access port problems. These complications are serious. We have a need for a safer bariatric alternative, and we can ask the question, are there any? The answer is yes, based on the discovery that all fat is not metabolically equal. Fat is divided into compartments, and we have certain clinical clues as to the amount of fat in each compartment that you don't have to take an MRI or CTT to estimate. The metabolic rate is an indicator of the amount of subcutaneous fat, which is the majority of the fat in the body. Fat basically doesn't burn calories as fast as muscle. Visceral fat is indicated by the waist circumference and the triglycerides, 2 of the things that we just talked about in metabolic syndrome. So you see right away that metabolically, visceral fat is the fat that's more important. Visceral fat is a dangerous hormone factory. It secretes noxious things that raise the blood pressure, promote insulin resistance and type 2 diabetes, cause irritation in the arteries, causing clots and narrowing, and this inflammation causes autoimmune diseases and cancers. It shortens your life, reduces the quality of your life, and kills you. We can treat this belly fat directly with an endoscopic removal as a new potential treatment. The company happened upon this serendipitously because the tube within a tube, safer, gentler design for removing subcutaneous fat allowed large volume fat removal, sufficient that we could actually remove the fat outside the belly on the waistline, sufficient to improve metabolic syndrome. But the tube within a tube is by its very nature an endoscopic instrument. So we were just awarded 2 U.S. patents for the visceral fat removal, endoscopically removing the fat inside the belly fat, in the treatment of type 2 diabetes, obesity, and metabolic syndrome. The company has metabolic-related U.S. and international patent applications pending. The visceral lipectomy technology allows a way to help many of these obese and overweight patients, both cosmetically and, more important, functionally, and to do so more cheaply, with less risk, and in a shorter period of time. We can avoid the intra-abdominal foreign bodies, restrictive or bypass surgeries, and the associated risks and complications. The sampling technology will allow identification and targeted removal of the most metabolically active and most dangerous fat. The innovative features of this design, to emphasize, allow the minimally invasive removal of hazardous visceral fat. The sampling and identification of metabolically harmful fat result in an immediate metabolic improvement and kickstart a healthy life change without restrictive or bypass surgical complications. This offers a less invasive treatment for obesity, metabolic syndrome, and type 2 diabetes with fewer potential complications. At the right there is our endoscopic handheld visceral lipectomy device. Of course, this could be done robotically as well. And that's the trocar, the device through which it's inserted into the abdomen endoscopically. Below is the bipolar cautery device that allows it to function, minimizing any bleeding. The advantage of the visceral lipectomy system and method is that it allows the safe aspiration of the more noxious visceral fat, belly fat, within the abdomen with endoscopic means as a new and patent-protected method for bariatric treatment. This aspiration and sampling technology allows the identification and targeted removal of the most hazardous fat. These are the cover pages of the 2 patents awarded to the company this year, one in January and one just last week, June 18th. The short-term goals, which are the goals of this fundraising campaign, is to make an alpha prototype with full electromechanical functioning, basically adapting our subcutaneous liposuction designs, incorporate bipolar cautery into this design, adapting devices that were prototyped for liposuction cautery, refine this model into a beta prototype incorporating bipolar cautery for endoscopic use, and to perform preliminary bench tests on this fully functional beta prototype for visceral lipectomy. The next intermediate phase will be laboratory testing in animals, and to obtain funding and/or strategic partnership for clinical testing. Hopefully this will result in an FDA pre-market approval. The ultimate goal is, of course, to offer EVL as a safer alternative, or at least an additional method of obesity control for the armamentarium in the treatment of obesity. Thank you for listening to this presentation. We'll very much appreciate any of your help, even if it's only calling attention to the campaign, and certainly welcome your donations to help forward our goal. Any interested parties with any questions or any potential investors or strategic partners, please feel free to contact me. My email is on the screen, as are our phone numbers. Our office is in West Palm Beach, and please visit our website to see our liposuction equipment, which has received 510 clearances and is available for purchase at the present time. Thank you very much for listening to this presentation.